Hello, everyone, and thank you for joining us today. My name is Susan Blumenfeld. I'm the Director of Training and Technical Assistance with the National Center on Domestic Violence, Trauma, and Mental Health. Our webinar today is Supporting Wellbeing. I'll be presenting along with my colleague, Cathy Cave, our Senior Training Consultant with the Center. Before we get started, I'd like to go over some of the technical details of our WebEx software that we're using today. Many of these details are explained on the Using This Webinar System tab in the center of your screen. And you can switch to look at that by clicking on the down arrow next to that. Please be aware that your screen might look a little different depending on whether you're using a Mac or a PC. On the right-hand side of the screen, you'll see multiple boxes. The third from the bottom is the chat feature. You may have to click on the chat cloud icon at the bottom center of your screen to open your chat box. This feature will allow you to provide feedback and share resources with your fellow colleagues, as well as contact us if you have questions as we go through the presentation. You can also contact Carla Alegria with our center if you have questions troubleshooting the software. So to do that, you click the down-facing arrow and select the person you would like to contact. So this is in the chat box. You'll see a lot of options, but for this session, you'll want to select all participants. If you would like to respond to anything that we're saying as the presentation goes along, or to contact Carla during the session. And you can privately contact Carla if you need troubleshooting. So let's test out the chat feature. Will everyone please go to the chat box, click on all participants, and then type in where you're calling from and then press enter. We'll see if this is working. Let's see. I'm seeing lots of names come up. Great, terrific. Thank you all very much. Excited that folks are joining us from around the country. While we know that people can get a lot out of the chat feature, there are times when it's moving really quickly, like right now, and can feel distracting. If this is true for you, feel free to minimize the chat box by clicking the arrow next to where it says chat. You can always open it again with the same arrow if you choose. We will be providing live captioning during this webinar. Below the chat box, there is a media viewer box. This will contain the captions. If you do not want to see the captions, click on the down-facing arrow next to the word media viewer in the same way you would if you wanted to hide the chat box. If there's time permitting, we'll have a little time to respond to any questions or comments that you might have as we go through the webinar. At the very end, and we'll be on for an hour today, you'll be taken to a brief survey. Please take a moment to let us know what you thought was useful and what could have been better. If you get disconnected at any point, return to the email you received with the original webinar link and re-enter the training. Sometimes the sound cuts out due to internet connection, weather, etc., so feel free to call back in if that is a problem for you. If you're experiencing technical difficulties and are unable to contact Carla Alegria, you may call WebEx tech support to resolve any issues. The phone number, which I'll put in the chat box, is 1-866-229-3239. Again, thank you for joining us today. And now at this time, I'm really delighted to have my colleague, Cathy Cave, join us as we start our presentation. Cathy?
Hello, hello. Just checking, can you hear me all right?
I can hear you. Can everyone else? Hopefully, can hear Cathy too.
Welcome. Thanks for joining us today, everyone. And Susan, thanks for getting us started today. So we're going to be talking about supporting well-being. and the ways that, given the current conditions, what would be helpful, the ways that we can connect to one another, and really be thinking about some strategies that help with grounding and staying centered and connected. Susan,
Absolutely.
did you want to add anything else before we head into this?
No, I think that's a lovely beginning, and we're just looking forward to talking about something that I think is really timely for all of us right now, which is supporting our well-being. So
Mm-hmm.
I will move forward then. So just a little bit about our center itself. We're a federally funded training and technical assistance center, and our center supports programs and helps to improve systems capacity to meet the complex needs of domestic violence survivors and their families. And we have a range of materials and archived webinars on our website that address the intersections of domestic violence, trauma, mental health, and substance use. And so if you're not already familiar with us, we invite you to check that out further at your leisure. Okay, Cathy, I am going to turn it over to you now.
All right. So at the National Center, one of the things that we've spent a great deal of time thinking about is a platform or a framework for the way we think about the work we do in domestic violence and sexual assault, and kind of thinking about mental health conditions and trauma, and what does all this mean? So in our framework, what we talk about is that we have to have a deep understanding of the impact of trauma and violence in the lives of survivors, and also thinking about that for all of us, right? And then there's always a social justice context to the work that we do. So it's thinking about for each and every person that we're connected to and supporting, what are the ways that we're thinking about their rights and as part of our advocacy, and thinking about social justice in the larger context of our cultural, historical, and community experiences as well. And then for the pieces that are on the inside of this diagram, a survivor-defined approach, physical and emotional safety are central to what we do and how we're thinking. The importance of relationship and connection to support healing, and then making sure that hope and resilience are part of not only what we talk about, but how we talk about it. We believe that healing is possible. So as we're thinking about our work together today, keeping in mind that central to all of the things we do, that choice, safety, collaborative, positive relationships that really honor who people are, and their whole selves, and supporting resiliency in every context that we can. So thank you so much for, again, joining us today and for thinking about these conversations, against this bigger picture of how we do our work. Next slide, please. So as we get started, one of the things that was important as Susan and I were putting our thoughts together around this conversation around well-being is actually practicing the things that we talk about. So I'm going to ask folks to join us in a really brief breathing activity. And this one is called square breathing, and we'll have some other grounding and centering techniques that we'll talk about as we spend time together today. But with square breathing, what you want to think about are those really dark brown coffee beans that are on the right-hand bottom side. And we start there and imagine this square, or look at this particular square. And as you breathe in, we go from the bottom to the top of the square. And then just pause a minute. As you exhale, go across the top of the square from the right side to the left. Exhale. As you inhale again, you go from the top to the bottom. And as you exhale, you go from left to right. So just one more quick practice of that. So breathe in, go from the bottom to the top. Exhale, go from right to left. Inhale, go down from top to bottom. Exhale, go from left to right. And so at any time, if you're feeling that tightness in your shoulders and needing to get, settled, that uncomfortable feeling, I sometimes talk about it. I feel like I'm wearing an itchy shirt. To take a second or two. I mean, this square breathing you can do in a minute, and just do a couple of rounds of that to help feel grounded and centered and connected, and really help us get focused and able to have hard conversations that we're all having in all different parts of our lives. Next slide, please. So one of the reasons we wanted to have this conversation is because we are having some shared experiences. What's happening is unique. We had a long, and still have a long battle to go with COVID, and really thinking about, what are the things that means for us when we've shared this experience, but we're impacted in different ways. And so there's what we do to handle ourselves and manage in the day-to-day, and many of us are working, in advocacy organizations and continuing to do that work in circumstances that are unusual. I think the other thing, just to, as a backdrop here, is that, there's a great deal of unrest across our country right now, and many of us are impacted by what we're seeing, what we're experiencing, the conversations we're having. So to be clear, the times that we're in right now, the things that we're experiencing right now, this combination is unique. And at the same time, it brings up some long-standing concerns. So next slide, please. So as we talk about what is unusual, right? So there's, again, just the constant barrage in the news around what's happening across the country, how people are experiencing COVID, how we are thinking about our own safety and our own healing. We're working at home in new ways. Many of us have done a little of this. Some of us have done a lot of this, and some of us have never done any of this. That we're parenting while we're homeschooling, while we're working at home. And so during a pandemic, and again, during these times of unrest, really thinking about that is not the norm for most of us. And so even though we're adjusting and adapting all the time and that things are swiftly changing, we also have to think about the impacts of these changes can be long-lasting for us. Some of us are doing caregiving for other family members that may be in our home or outside of our homes. So there's a level of worry and concern, again, about safety in both a health sense and in an emotional, social connection. Are we able to be together or not be together kind of a sense? Many of us have lost income. We've lost our social contacts. And many of us have lost access to supports that have been long-standing and can mean the difference in terms of how we do our work, how we work in teams, how we get through the day, how we take care of our families. And then we're also grieving these losses. And so, again, there are so many ways that grief shows up that's unique to each and every one of us. And I had an experience in the last couple of days where I realized that I was holding a lot of fear and a lot of grief and not quite sure what to do with that. So really had to spend some time, talking with people who I can count on for support, but really certainly missing the ability to go have those face-to-face conversations about really important things. The shifts that we've had to make were unexpected initially. And then, so many of us in our programs, we did make some successful shifts. And we tried new things, and we tried working in ways that was unique. So maybe all of my work was in person, and then much of my work became more virtual. And how do we have contact with the people that we're serving? So across programs, across the country, many, many, many of us have had to make these big adjustments. And again, although they were initially unexpected, we adapted and we figured it out. And then things started to change again just recently, where some communities are starting to open up, but some more slowly and cautious, some, people are out. So it's thinking about whether the feelings that come up that are connected to all these shifts and the things that we're grieving, and concerns for loss of life is included in that. So these are not small things. Next slide, please. So important to notice the distress in our bodies. So I can tune out a lot of things in my life. I can tune out, if the news is on and it's just too much, I can turn it off and tune that out. But it doesn't stop me from feeling the feelings, like the tension in my chest or the, knot in my shoulders. And so when people are in distress, what we start to notice is that we can feel it in our bodies and we can hear it in the ways that we talk to one another. We can see it in the ways that people are treating each other, and we can sense it in our attitudes. So, I may have a little bit of a snippiness in my voice when I don't intend to, but the distress that I'm experiencing may be bringing that. So I'm finding that at home I'm doing a lot of some pre-apologies. So I can say, I've got a lot going on today. I'm doing a lot of work. I'll be talking about trauma all day. So I just want to give my family members a heads up that today's a tough day. And then sometimes I have to go back and apologize later and do some repair because I was, snippy in my tone, or I missed something, or there was something I said I would do and I didn't quite get to it. And what I'm hearing from folks as I'm talking is, there's a constant low-grade irritability that folks are talking about. And so then when there's something that happens, that's either on the news or you're hearing it from friends or, seeing it in social media that is distressing, that low-grade irritability, just jumps up, amps up to something much larger and much more visible sometimes. That people have talked about just crying while we're watching commercials, especially when, there's a shift in what's on commercials. So instead of selling whatever product that is, people are talking about and advertising, like, let's stay connected, let's be together. Some of those messages that are really very heartfelt, but can bring all of our feelings right to the surface. And then other folks have talked about just being worried about absolutely everything. And again, when we have, experiences with unrest across the country that we're all seeing and hearing about, that adds to the worry in some real and significant ways. So just to be thoughtful about the ways that we are experiencing distress, noticing when we experience it, because then we know we can do something, at least, in the moment to feel better or to help physically displace some of that distress. Next slide, please. Okay, Susan, I'll turn it to you.
Okay, thanks. So in all of what Cathy so eloquently described, it really helps if we can practice gratitude. And I love this quote by Joanna Macy, because gratitude helps to steady and ground us. I found this spring that I feel so grateful for being able to witness the unfolding of the natural world around me, watching the trees change from branches to buds to full leaves. Every day it's a little different. Watching the emergence of flowers, noticing the variety and vividness of the colors. And also it's reassuring to me to know that nature is cyclical and it's enduring in the midst of so much chaos in our lives and uncertainty and the grief that we're all experiencing collectively. And so I think for me personally, and it's different for everybody, of course, but when I take in the beauty of a flowering tree, or I love cardinals, hearing a cardinal sing, it brings me to a fuller sense of presence within myself, and I feel connected to something larger than myself. And I don't know about for you, but some people have really found it helpful to do a little more formalized gratitude practice, either in the morning or in the evening before going to bed, or really, truly any time, thinking about and maybe even writing down some things, 3 things that you're grateful for in your life. And I found it's in some of the hardest times that I've gone through in my life, and certainly since COVID began, that's been really grounding and helpful. And neuropsychologist Rick Hansen, whom some of you may be familiar with, says that when we can take in experiences that make us feel a part of something larger than ourselves or positive experiences, we have a sense of gratitude, that if we can take them in and actually savor them. So I'm an early riser. I see the sunrise, and it's gorgeous. I take a picture of it on my phone, and then I savor it for 15 seconds or more. And Hansen says that this helps us rewire our brains that are, so preset with that negativity bias. We're hardwired that way because that's what's helped us survive. And certainly we're all, as Cathy was describing, noticing distress within ourselves. So it's a nice antidote in that way. Other folks that I've known have found like a gratitude buddy. So they send a text or an email to each other every day. It keeps them connected, and there's a kind of giving and receiving what we're grateful for. Cathy, I don't know if you wanted to add anything on to this at this point.
Sure. Thank you. I mean, one of the things that we do in our family, so I have a giant family, a large extended family, lots of cousins, nieces, nephews. And so we have a family text that is for positive space only. So we have all kinds of conversations about things that are hard. But in this family text, we start every morning, we do a round of good morning, and at the end of the day, we do a round of good night. And then during the day, someone might send a picture of one of the grandkids or the nieces. So for us, it's really thinking about we're entirely grateful for our family and not just staying connected, but also acknowledging that gratitude is a practice and doing it with one another. Thanks, Susan.
That's lovely. Thanks. I'm sure others are thinking about what they do as well.
I would invite folks to add it to the chat.
Yeah, absolutely. Please feel free. And if folks want to do it in the chat, we can see all of that as opposed to the Q&A. If you have something specifically maybe for Carla, then you can put it in the Q&A. So mental and emotional well-being. So this quote is from a domestic violence survivor and parent. I feel like I'm running a marathon without a finish line. And this was something that I heard from her before COVID began. So it really I'm inviting us to think about how were we coping before and how are we coping now. And now with all the additional pressures and concerns that we may have, the families that we're working with may have around basic needs and safety and well-being for their loved ones. So we may find ourselves feeling a little off balance and dysregulated, cranky, as Cathy would say. And I know I've found that my sleep can be much more easily dysregulated, and I know I'm not alone reading blogs across the country. So what worked before may no longer be working now. And we may have had routines and ways of kind of grounding and centering ourselves that really we can't handle now because we're feeling exhausted more, less productive. We may not be checking our work emails in the middle of the night or watching the news right before we go to sleep. So I think it's really important if we can ask ourselves, what do I need to be okay right now? And check in with ourselves throughout the day. So it's not just, once a day, and then I know for myself, it's like when things don't go as I think they're going to go, or I try things that are going to make things better, that I just have to take a deep breath and just say, just be a little patient with yourself and show yourself some self-compassion here. It's not always going to be a quick fix. So I think, and Cathy really talked about this earlier, that we may find ourselves feeling a lot less flexible in how we're responding to people, what our boundaries and communications are like. They could get more rigid at a time like this. And we may feel less creative and less productive and more exhausted. And for many of us, we may feel like we have to hide our overwhelm to keep up a positive front. And we know then that can take a toll on our bodies too, and our minds and our hearts. So we may also be carrying the stigma and fear of being labeled or noticed as not emotionally well, and somehow we're not measuring up. And certainly there are lots of concerns and supports out there for folks who are really feeling more distressed than usual. Okay. Cathy, I'm going to turn it over to you.
Thank you. So, excuse me, part of the conversation, for all of us is that culture informs our approaches. That there are things that we just do because it's the way we do it. So culture informs our expectations. What is it that we view around parenting? What is good parenting? What's a good education? What is a good work ethic? How important is professionalism? How do we define illness, and what does it mean to be not well? And then what are our sources and the importance of resilience? So when we're in this, chaotic times and there's a pandemic, there's so much to think about in terms of how we show up and how are we showing up. But I would ask folks to also to take a look at what are our expectations for how we show up. So it can be really challenging to kind of stay on top of things, to manage all the things that are on our to-do list for home and work. And those expectations are set very early on in our lives, and then they're added to. So, I learned my work ethic from my family, and then I went to school and I learned a profession, and then I learned what that meant for me because that looked different 20 years ago than it does today, and what those things mean to me look different. So there comes to be kind of a settledness over time around this is how I do it, this is my approach to work, this is my approach to the world. And one of the challenges for chaotic and distressing times is that the things that we thought or knew were solid and good and felt strong come into question. It doesn't mean that we're all falling apart, but it does mean that we might be feeling out of balance or unsettled, and that our resources for resilience, the things that always work to kind of shore us up, may not be working right now. And it's also hard to tell what's good enough. And so one of the things I think about is that my son is parenting. One of his kids is school age, and so there's apps to do. There's, to check in, and there's homework assignments there, and then there's other homework assignments in other places. And there's how much time and how many hours are spent in his child's education. And while he's happy to do it, it also stretches how his household works. And so the same was true for me. There are certain ways of being in the world that worked for me. I had patterns that worked. I had routines that worked. And I had things that, helped me stay connected and feeling that I was totally on the right track. And then, again, right now, it's really hard to know. It's hard to feel solid. It's hard to not judge ourselves around, am I doing the best I could do right now? Or, why is it that I can't do, the 10 things that were on my list today when, 3 months ago, 4 months ago, I would have done this easily. So under distress, our capacities really do shift for what we can pay attention to, for what we can continue to do in spite of what's happening around us, and thinking about what's happening around us and how do we change and adapt. So there's this constant movement that can push us beyond what we thought was real and right and true. So next slide, please. And so can we be honest? As Susan was saying, that it's sometimes hard for folks to say, I'm struggling, and we may need to feel like we have to front that we're doing fine. Look at so many others who are not as well off or as in good positions as we are. I have food every day. I'm not looking for that. I'm able to support people who don't have food. So we start to judge and second guess. And when we're overwhelmed and feeling overwhelmed, may not feel that we can quite say that out loud. And so sometimes, as staff and programs have been sharing with me, they didn't feel like they could tell someone. They couldn't go to their supervisor and say, these are my struggles. They felt they couldn't. And then when they did, and the response from the supervisor was, well, why didn't you tell me you're overwhelmed? And it's like, I didn't feel like I could tell you, is what some folks have been saying. So there's this disconnect between wanting to show up, be strong, be supportive, give everything we've got to folks who need us, and also being able to say, I feel good in my own right. I feel grounded and centered and connected to myself, and I feel like I'm doing all right. And so trying to be honest about that, and that when the answer is, I didn't tell you because I couldn't, that gives us more to talk about. So it's really being able to think about how we're being impacted and how we're grieving those losses. How are we, able to acknowledge what's happening and then do something about that? And if we need to be grieving, to press pause and do that. And if it starts with a breath, let's start there. And if it, leads to some deeper conversation or deeper practice around how we acknowledge the losses, celebrate our resilience, and keep moving forward, that those are big, big, big conversations. Next slide, please.
Thanks, Cathy.
Sure.
And I see folks have been putting some comments in about what's been comforting to them. A lot of folks playing with dogs and cats, but other ways in terms of spirituality and being with family. So thank you for those comments. So we're going to kind of take another layer of this and think about our role in caregiving when everything is in flux. And we've got parenting up here, but many of us are caregiving others, loved ones in our lives, relatives and folks in our lives. So some of us may have children, others do not. But I think as we're thinking about everything in flux, it's that what comes to mind is that what's working for us right now may not serve us an hour from now or this evening or tomorrow. And so having everything in flux is so challenging, especially for those of us who think they might be in control of the universe and realize they're not on a daily basis or moment to moment. And so it's so challenging that there are new worries that come up. I've heard some parents say recently that now that across the country many kids are out of school and they may no longer be filling in as the homeschooling parent, that now they're thinking about what am I going to do this summer, all these decisions about, well, do we expand the bubble a little bit and can we have a play date and what would that look like and, et cetera. So, caregiving can be fulfilling and joyful, parenting can be, but it was also difficult enough before. So it's really helpful to allow ourselves some space to pause and reflect on what we might need in the moment. And I think you're going to hear this as a theme throughout what Cathy and I are saying this afternoon. What do we think is going to nourish and replenish us right now? What feels right? Does that mean to sit down and watch a half hour of, guilty pleasure junk TV, or does it mean to get out and move and take a walk, or just be quiet to try to steal 10 minutes of a nap, maybe to call or text a friend or a relative? I think it's so important to have space that is quiet and private and so difficult for so many people right now. I think over the long haul, we want to take this time as we're pausing and reflecting to think about how can I be present, truly present, authentic, and attentive. And I know that even, I think for most of us, feels more like an aspiration. It's not something that we can do all of the time. But I think the more we can allow ourselves that space and time, and as Cathy said, when we could kind of fly through a to-do list maybe 3 months ago, we can't right now. So this does give us an opportunity to kind of think about and sort things through. And also, to be intentional about what we share with our children. That brings more connection between us. So, again, depending on what we grew up with, what our cultural practices and beliefs are, we may feel like we have to shield our children, especially younger children, from how we're feeling or what we're doing. But we know that kids pick up on our emotional and mental states quite easily without words. So it might be saying, I'm worried about grandma right now, and this is what we're doing. We're not with her, but, here are the ways that we're staying in touch with her, and wouldn't it be nice if we could give her a hug? So I think this is a time for us to think about in our parenting role, for those of us that are parenting, how can we really be with our children without trying to fix or change their feelings right now, and to allow the same space for ourselves. So this leads into the next topic of supporting our children's well-being. So what I'd like to invite you to do now in the chat box, if you are so inclined, is to reflect on something if you're in a parenting, caregiving role, what you think is going well, and maybe something that has been challenging, or what's your biggest worry or concern right now. I think it helps sometimes to get those things out and to share that with others if you're comfortable with that, and to really reflect on that. So we want to be able to continue to share information with our children depending on their age, what they understand, what they can take in. And we're in a position where we're trying to respond to and answer their questions without knowing all the answers. And it doesn't seem like we know all we need to know about COVID yet. So it can be very difficult to answer some children's questions, like, why do I have to have this mask on? And it's scary to me, or I can't see their face when we're outside, or, things like that. And also I think that younger kids in particular can pick up on words that older siblings or adults are using, and they start to make I remember this myself as a child, they start to make their own meaning or distortion of what they're hearing. So that can become scary, even the word like social distancing. So I think we want to make those opportunities to be able to sit down and see what's on their mind and what they're thinking about. And let them know what's going on that's good and positive in the world, that the efforts that healthcare workers and scientists working on vaccines and others are doing, and what we can do together as a family to stay healthy and well. So certainly establishing new routines can be so helpful in creating a sense of emotional safety and calm. Kids want to know what's coming next and then what. And setting a schedule and putting it into action, easier said than done, particularly with older kids and teens, can be very helpful, though, for ourselves and for our children. And I think with older children and teens, it's helpful to bring them in as partners to think about how are you spending your day? Kind of just getting a sense of Am I, doing game stuff for 5 hours without stopping? Am I up till 3 in the morning? What other things? How else am I spending my time? How am I resting? Do I have time as a teenager to reflect? What ways am I going to connect or reconnect with my friends who I may be missing very much? So I know for me in all of this that this really kind of pushed me to setting some new routines for myself during the day. So I have like a early in the morning, very early in the morning routine where I set an intention for the day, I meditate for a little bit, and I exercise on a regular basis. And I find that so grounding and helpful. And, of course, everyone's situation may be different, but it means finding some way to think about that. And I think we have to have understanding and patience with each other. I was thinking about one of the first slides that Cathy talked about in terms of we're all experiencing the same thing, but in unique ways. And so as we start to think about, as one of my colleagues says, coming out of our bubbles, if we have been sheltering in place, then we have a whole new set of decisions and things to talk about with our children to figure out what's going to be okay and what we think we can take as a calculated risk and what we really can't because we're caring for somebody who's elderly or we ourselves are older or we have an underlying health condition or we have a child with an underlying health condition. So really being, I think, I would say kind to one another around what we're going through right now and giving a lot of latitude to each other during all of this and figuring out new and creative ways to celebrate milestones like birthdays, graduations, and to figure out some ways. I know I have some friends who have said that at least their kids are getting out and riding their bikes. They can't play baseball, but they're riding their bikes, So what can we do during this time? And then, we can be very hard on ourselves in terms of what we think we need to do as parents and caregivers of our children. And so loosening up a little bit if there's still some kids are still doing schoolwork, but not maybe being as rigid as we were before about screen time, because we know a lot of screen time is not necessarily good, particularly for young children or for any of us. And so just, letting things be so that we can get by. And one colleague said that, if we can loosen up those expectations a little bit and just think about connection and care as more important than compliance with rules and what needs to happen. We may set a schedule and it all falls apart, and that's okay too. We can start again another day. Okay, go on to the next. All right, so I think we need more opportunities to self-regulate, and I have a favorite little something that some of you may already be familiar with, called Pick a Flower, Blow a Pinwheel. So I'd like to invite you to join me in this. It's a simple breathing exercise that I think kids in particular enjoy. What I'd like you to do is imagine your favorite flower. Think about its fragrance, its color, and then with your right hand, pick that flower. And now I'd like you to take a deep breath in to enjoy its aroma. And then imagine you have a pinwheel in your left hand and blow the breath out as you make the pinwheel move around. So let's try this one more time. So I hope if you have young children in your life that you can try this, because it calms us as the adults doing it as well. Okay. So that's one situation, that's one thing that we can do. But I think we can help our children to feel calmer and more regulated and more like themselves when they're distressed, when we can engage in some of the activities that we've been taught, some of the breathing activities, but dancing, yoga, being silly, making a ritual out of having a bowl of popcorn together as you snuggle and watch a TV show or some other treat. And then I think for a number of children, hold on, I'm sorry, 1 second. It can be really helpful, and for adults too, to take something called Take Two, which is you just literally shake your body all over. You can do this standing up or sitting down, but you shake your hands and wrists. Join me in this if you feel like it. Wiggle your hips, your legs, your ankles, your neck. Stretch out your neck, your feet and toes, and you can even put on music if you like. And that's like a 2-minute release, and it's easy. And then one of my favorites is something called Draw a Peaceful Place. And you can invite children to draw a real or imaginary place that makes them feel calm and at ease. And for younger children, you may want to help them fill in the details. It might be like smelling grandma's biscuits or snuggling in a cozy blanket or a young child's special stuffed animal or lovey, or looking at the stars together. And you can talk about it with your child or children and then find a handy spot to put it up where you are. And then let kids know that they can go to this peaceful place whenever they want in their minds. And then if the picture's up somewhere where you are, where you're living or staying, they can look at it and it's a reminder. And spoiler alert, adults like doing this too and can really get into drawing this. So, okay. So I wanted to tell you about a resource that summarizes a little bit of what I've been talking about, but it's a resource that we designed for families affected by domestic violence, but hopefully it's helpful for everyone. And on our website, you've got the URL there. You can download each of the pages as a standalone, because I know there was a certain point in all of this where people did not have the bandwidth for reading a 5-page PDF of anything, but you can also download the entire PDF. We've kind of tried this out with a few programs that I've been working with, and they really felt that this was helpful for themselves as advocates and therapists, but also for some of the families that they were working with, particularly if they weren't under siege at the moment and living with an abusive partner, because that can make everything more challenging, obviously. Okay, so, and you will have this as a handout along with the PowerPoint slides when those get posted in a week or so. But you can get this immediately on our website too.
Thanks. Susan, can I just interrupt for a sec?
Oh, sure.
So I wanted to just take a moment to acknowledge all the support that was happening in the chat box, that folks are really sharing ideas and around, how to support other folks, if you're a supervisor, how to support staff. And it was just some really touching commentary that folks were offering to one another, and I just wanted to appreciate that. And so one of the comments was around, supervisors really kind of reaching out to staff in ways that may have been different, and because of where we are right now, and saying, how are you, and just showing up for the conversation. And even if, and I do a lot of supervisory work, but just wanting to say that even when folks in the moment might not feel that they can share something that is touching them, the more you show up for conversation, the more you show up for the relationship, the more you offer, the more people can become comfortable with being vulnerable with one another. And I just think that is so important in terms of being able to be effective in our work and be effective with our families and be effective in trying to support the larger goods that are happening in the world. So I just wanted to thank folks for their comments.
Well, thank you so much, Kim. Oh.
Yeah. Oh, and the person who said, yes, we can't replicate school at home. So,
yes.
And that was right in line with what you were saying, so I wanted to point that out as well.
Yeah, and I have to say that I'm not good at multitasking, but I am scrolling through it now, and there was a comment in there about one of the participants saying that their child was really having trouble doing school at home. And, you think about how many kids have issues concentrating and learning under normal circumstances. So really have a lot of empathy for you around that, and know you're not alone and you'll get through it. And I think that care and connection over compliance is the way to go, even though we might feel like, oh, they have to do all these assignments and now I have to learn these different things and, et cetera. So, yes, so important. Thank you, Cathy. Really appreciate your jumping in with that. All right. Well, so we're getting towards the end, and what we're going to do next is both Cathy and I, each of us are going to demonstrate two ways to calm and center using our hands. And so I'll start off by talking about the first one that some of you may be familiar with, but it's something that you can share and share with your children or with the families you're working with, and it's called finger breathing. So if you're up for this, take one of your hands, open your hand, kind of put it in front of you with your thumb facing towards your face. And then with your other hand, place your other thumb at the base of the hand that you have up. And what basically you're going to do is on the in-breath, you're going to go all the way up to the top of the thumb, and then on the out-breath, all the way down. And you repeat that through your 5 fingers. And one of the ways that I talk about this with younger children is we're climbing up the hill. So let's take that first deep breath in as we're climbing up the hill. And then we're going down into the valley. And up and down. And up and down. And up and down. And up and down. So you get in 5 full breaths. I think for some folks, when they concentrate on deep breathing, that if they don't have a focus outside of, if they're just like closing their eyes, they can get flooded with things they don't want to think about or see or hear. So by being able to concentrate on something in front of you while you're breathing can be very helpful and effective. And for those of us who are subjecting ourselves to Zoom call after Zoom call after Zoom call, it's something that you can do in your lap without anybody knowing, as if you want to calm down. So, Cathy, do you want to take the next one?
Sure, thanks. And so, one of the things that, we notice a lot is that people often don't have the words to express, what's happening for them. It kind of goes back to that question around, why didn't you tell me you were overwhelmed? It's like I didn't tell you because I couldn't. I didn't have the words for it. And so there's an organization called Capacitar that works with folks in, different countries around the globe, and they really talk about doing calming and focusing and grounding and centering exercises with folks, and they teach it in this grassroots way. And so one of the activities that we learned about from their work was finger holds for calming. And so How this works is if you, I'm right-handed, so I'm going to use my left hand is in front of me, and my fingers are open and spread out. And then I take my right hand and completely cover my thumb. And so there are, of course, sensory points in your thumbs and in your fingers that really do help when you apply pressure to help you calm and center and connect with yourself. And so each finger or appendage here is given a different assignment for feeling, and you can do this with adults and you can do this with kids. So again, if I take my right hand and I completely cover the thumb on my left hand, that my thumb is the center for kind of holding grief, and I'm going to think about what I'm grieving. I'm going to think about what it is that is bringing tears. And I'm just going to hold my thumb for 5 minutes and breathe regularly and just think about that and center that. And so it's acknowledging, again, it's attending to the fact that we do have grief and we're noticing and that we're going to just try to sit with that feeling for a little bit. Not try to hide it, not try to fade it, just let it be and to notice. This, too, is a great activity that you can do anywhere. So as a trauma survivor, I've shared this activity with other survivors. And so when someone is preparing for court, for example, and they're afraid, and we talk about, if you take your whole hand and cover your index finger on your other hand and just hold it and just breathe through it, acknowledge the fear, and also that you're not there alone and that there are folks who care for you and who are in this with you. So your middle finger, as you might imagine, is for anger. And if you're doing this with kids, you can talk about, if you're mad, this is a good one. You hold your middle finger with your whole other hand and just think about what's happening and acknowledge that you're mad and feel that you're mad. And then when we're done, we can talk about it if you're ready, if you want to. And if not, that's okay. Right? The ring finger is for worry or anxiety. And so worry is a good word that, kids can use and can hear and take in. And your pinky is for, you're holding that when you're feeling small or feeling unacknowledged or that your own self-esteem isn't where you would love it to be or want it to be or need it to be. And so with kids, I might talk about, just kind of feeling bad about myself. So there are ways to use these kinds of activities to support, again, noticing that your body is having some distress, thinking about what is it that I can do once I know that this is a particular thing that I'm distressed about, putting some calming energy towards breathing, towards acknowledging, what is distressing and what hurts, and then thinking clearly afterwards, is there something I can do next? So these are good things to do, like in between calls, in between tasks, in between jobs, in between taking care of the needs of other folks, taking a moment to take care of your own needs, to feel grounded and centered and connected.
Great. Thank you, Cathy. Sure. And I'm seeing through the chat that folks have been using some of these and also appreciated the humor of the middle finger. And if you think about the thumb for grief and emotional pain and soothing, lots of kids suck their thumbs, right?
Yeah.
Okay. So, Cathy, you're
Sure.
awesome.
We have some resources that we found helpful in addition to the resource that Susan shared with you. A few other things. Millie Grinnell talks about things to do that are very quick in the moment while you're at work. So Oasis and the Overwhelm is her work. the folks who have created trauma stewardship, again, really thinking about the impact of all of these experiences on our whole bodies, our whole organizations, and everyone that works within your programs. Virtual Room has been just really very popular, and people have been talking a lot about that, being a good resource since COVID-19 became something that we had to deal with every day, and people are socially distancing and missing the connection, so folks have found that helpful. And then there are a few others here around team building in the time of COVID, because, again, we're also scattered in the way that we're working and finding new ways to cope and taking care of yourself during a public health emergency. I think this underscores for me the importance of, we do need to acknowledge that we're worth being taken care of. It's worth it to us to take care of ourselves. Next slide. Susan, do you have a time to do the self-compassion break?
For you.
There you are. Susan, I couldn't hear you, so I don't know if others had that same experience.
Can you hear me now?
Yes.
Oh, great. Okay. So because we are out of time, just to say some of these resources will be on our website for you, and I think we're going to go to our ending now because we have run out of time. And you will be taken to a very brief survey at the end of this. And thank you so much for the comments that have been in the participant chat. And Cathy and I have really loved talking about this stuff and loved having you participate today. So thank you so much. And we wish everyone good health and wellness.
Thanks,
and
everyone.
Safety. Thank you. Okay. Let's see. Hello?